You can turn subtitles on by clicking this symbol in the bottom right corner. By clicking the cog next to this, you can also adjust the playback speed to make the speech whatever speed you feel comfortable listening to. This video is split into different sections, which are called chapters. At any point, you can pause the video, take a break, and come back to the video at another time. To move through the chapters, you can use the timeline, or below the video, in the description, you can see the different chapters listed out, and clicking on a chapter will take you to that section of the video.
Hello, and welcome to the imaging department. Imaging is the name we use for the department in the hospital where we take pictures using special machines to look inside your body. Today, we're going to show you what happens when you come in for a CT scan. There are many reasons why you might need a CT scan. You might be sent here by your GP, a doctor, or another team in the hospital. Arrival and booking in. When you arrive, you'll check in at the reception desk. All reception desks look a little different, but this is what ours looks like. Don't worry, if you forget your appointment letter, you can still check in. You can have a friend, family member, or carer join you when you come to our department, but they will not be able to come into the scan room. They will be asked to wait for you in the waiting room.
If you have a service dog, they can't come into the scan room. Somebody else must come with you to the hospital to look after your dog while you are having your scan. Our staff here are not allowed to look after your dog for you.
What is a CT scan? A CT scan uses X-rays to take detailed pictures of the inside of your body to help healthcare professionals with your care. These pictures are called slices because they show a small section of your body at a time, like slices of bread in a loaf. The person who performs your CT scan is called a radiographer. They will explain everything to you and make sure you feel comfortable. Inside the CT room. This is one of our CT scan rooms. Each hospital may look different, but the machine works in the same way. The CT machine is a large donut-shaped scanner. You'll lie on a bed that moves through the hole in the scanner. The scanner doesn't touch you and the scan doesn't hurt. There will usually be paper on the scanner bed. This is to help keep the beds clean. The paper is put into the bin after each patient has finished in the room, and fresh paper is put on for the next patient. Please do not worry if the paper moves or rips. It is not a problem at all. You can bring comfort items with you, such as a blanket or toy, but they can't have any metal on them. Getting ready for the CT scan. Depending on what part of your body is being scanned, you may need to change into a hospital gown. This is so items like zippers, buttons or jewellery don't affect the pictures. You will be able to change into the hospital gowns in our changing room.
Some hospitals may have a locker that you can leave your clothes and personal belongings in. At other hospitals, you may be asked to bring them through to the CT room. A member of staff will let you know the best place to leave your clothes.
If you're sensitive to clothing, you can wear plain pyjamas or a t-shirt and trousers without metal parts. You may also be asked to remove jewellery like necklaces, earrings or watches. Sometimes there are some extra things you need to do to get ready for your CT scan. You might be asked not to eat or drink for a few hours before your scan. This is called fasting and helps the scanner take clear pictures of your body. For some scans, you might need to drink lots of water before coming. This can help the scanner see certain parts of your body better. The radiographer will tell you what you need to do before your scan, so don't worry, they will explain everything clearly. The scan process. When you're ready, the radiographer will help you lie down on the bed. You might have a pillow or straps to keep you comfortable and still. If you use a wheelchair, don't worry, our team is here to help you feel comfortable and safe during your CT scan. The radiographers will help you move from your wheelchair to the CT bed. If you need extra support, we have special equipment to assist you. During the scan, you will lie on the CT bed, which will move through the scanner. The bed is designed to be comfortable, and the radiographer will make sure you are supported. The radiographer will go into a separate room to control the scanner. But they'll still be able to talk to you through a microphone, and they will be able to hear you, so you can still talk to them if you need to. The CT scanner may make some noises, like a soft whirring or clicking sound, as it takes the pictures. These sounds are normal and you don't need to worry.
Breathe in. Hold your breath.
During the scan, you need to stay as still as possible so the pictures are clear. The radiographer might ask you to hold your breath for a few seconds. After holding your breath, you'll be told to breathe normally again. The radiographer will talk to you through the microphone and let you know exactly when to hold your breath and when to relax. It is only for a short time, and they will guide you every step of the way. CT scans usually don't take very long to do. They will often take less than 10 minutes from start to finish. Using dye. Sometimes the radiographer may use a special liquid called a dye to help certain areas of your body show up more clearly in the pictures. This dye is given through a small injection, usually in your arm or your hand. We understand that injections can make some people feel nervous. If you're worried, let the radiographer know. They will explain everything to you and help you feel as comfortable as possible. The injection might feel like a quick pinch, and you may notice a warm sensation or a strange taste in your mouth, but this goes away quickly. The radiographer will be there to support you and make sure you're okay throughout the process. After the CT scan. Once the scan is finished, the radiographer will help you off the bed and tell you that you're all done. They'll also explain how you'll get your results. If you had a dye injection during the scan, your body will naturally get rid of it through your urine within a few hours. It's important to drink plenty of water after the scan to help flush the dye out of your system. The dye is very safe for most people, but if you have any concerns or feel unwell after the scan, let the radiographer know or contact your doctor. You can then leave the CT room and go home or back to your ward.
Reasonable adjustments. Reasonable adjustments allow you to ask the staff to make small changes to your appointments so that they can accommodate you better and give you the best experience possible. This can be things like asking if the lights in the scan room can be dimmed or turned off, asking if there's a quiet waiting room that you can wait in, asking if your appointment can be scheduled at a less busy time of the day, or asking the radiographer to use simple language when explaining what is happening during the appointment. You'll find our contact details on your appointment letter, so you can get in touch ahead of the appointment